Welcome to Conceive the Podcast, your resource for all things fertility, women's health and pregnancy, with your hosts, Jaya, Chinese medicine practitioner and Director of Natural Fertility Geelong, and me, Libby Morgan, Practice Manager and Jaya's friend. Hi Jaya.
Hi Libby.
Hi everyone. In this episode, I'm going to be asking Jaya some questions about acupuncture and Chinese medicine, so like how it works, why we use it in fertility, the philosophy behind the clinic, and answer some of the questions that we get over the phone about natural fertility and how this all works.
Great.
So I'm just going to ask you a really broad question to start off with.
Go for it.
How does acupuncture work?
Yeah, this is one of the most common questions we'll get, and it will often be as we're putting the needles in, so I've got a really short time frame to explain something that's quite large. I think every acupuncture would answer this differently, but this is my take on it.
Okay.
It involves tiny needles that are inserted into acupuncture points, or some people know them as acupressure points if they're using their hands.
Mm-hmm.
And we are trying to create a physiological response from the body when we put the needles in. So acupuncture points run along meridians, which are the energy pathways of the body, and we're trying to influence these energy pathways.
Okay, yeah, that makes sense.
Probably seen those models, those bodies, and they've got the
Yes.
points everywhere through the body, and they're running along meridians, and they're the meridians of the lines.
Ah, okay.
Yeah, so acupuncture aims to work with your qi, which is your body's energy, and blood. And our aim is to bring your body back into a natural state of balance. Where there's excess or stagnation, we want to move your qi and blood with acupuncture. Or if there's areas of deficiency, we want to use points that will help to strengthen your body.
Okay, so there are deficiencies or stagnation along the meridians?
Yes.
Okay.
Yes. I mean, it's a bit complex, but definitely meridians, acupuncture points, but we also involve your organs as well.
Okay.
So different organs will relate to those meridians.
Huh?
It's like a whole different system we've had to learn over many, many years.
Yes.
So each acupuncture point has a different function and indication for its use. So at uni, we had to learn most of the points.
How many are there?
Over 300.
Oh my goodness.
And 14 meridians, but we had to learn all the actions and indications of each point.
Wow.
And
That's a big study load.
yeah, some of them work independently on their own, but then they have this relationship together.
Okay.
Certain points will pair together to do certain things. That's from a Chinese medicine point of view. From a Western medicine perspective, it's thought that acupuncture works on the biofeedback from the central nervous system to the rest of the body. Acupuncture is thought to influence the chemicals that are sent to various parts of the body. For example, it is thought that acupuncture influences the secretion of gonadotropin-releasing hormone, which will then influence the secretion of gonadotropins, which basically means that this could be how acupuncture influences ovulation and alters the menstrual cycle and reduces stress.
What's gonadotropin? I don't know what you just said.
That's okay. But basically, what I'm trying to say is that acupuncture is talking to your central nervous system and then influencing the chemicals which are released. This is basically how hormones are influencing things like your ovulation and your menstrual cycle. Different points that are used in different parts of your cycle can influence what we're trying to do. Certain hormones.
Influence the release of different things.
Yeah, so if we're trying to work towards ovulation from a Western medicine point of view, it goes through the brain first, and then the brain basically tells your body what to do. Everything just comes back to the brain. It's so important. There's so many physical functions of the body.
So the brain in terms of how that then relates to the nervous system, what's released,
Yeah,
biofeedback,
how we're regulating things, the whole relationship, like all the messages that are going to different parts of the body.
Acupuncture can influence those messages?
Yes. That's what the research says.
Okay.
Or is suggesting.
Yeah. So Chinese medicine, the perspective is quite different than to Western medicine.
Yeah, I really feel like we learn two different types of viewing the body, and then as an acupuncturist, we're trying to think about how they relate to each other. So in Chinese medicine, we view the body as one whole organ. Everything's connected and can have a flow-on effect. So when we're aiming to treat a condition, like I said before, we want to bring everything back into balance, but we also want to treat the root cause, not just the symptoms. So we're looking at, this is the problem that you're having, but where did it come from? And how can we help your body to heal itself at that level. Each treatment is really individualized. So there's no protocol-based treating with acupuncture.
Oh,
It's
that's really
just
fascinating.
every single person could have something completely different and a different treatment protocol as well.
And so then when you're using things like pulse, tongue diagnosis, it's helping you look at the individual
Yes, so
and
it's
assess.
helping us see what's happening inside of their body. And each acupuncturist will have a different style of treating as well. You could go to different people and they will have a different view of what's happening, but it doesn't mean it's wrong. Just finding what works for you. And sometimes it's more than that. It's how you connect with the person, how much trust you have, share a lot of the same values in how you treat.
That relationship's really important.
Yeah, and I think education's a really big part of it too.
So client education.
Yeah.
Yep. Our clinic works a lot with men and women in fertility, hence the name Natural Fertility. But what specifically is Chinese medicine and acupuncture doing to help fertility?
Yes, I think acupuncture has become really well known for treating fertility now, or working in that scope of IVF support. It's a pretty unique area, and I would say there's no specific training to say that as an acupuncturist you specialize in fertility. But a lot of practitioners do extra training. There's other practitioners within the industry that are dedicating themselves to teaching other acupuncturists. So the level of education has really come up. What it can mean, though, there's a big variation in the training and the knowledge that a practitioner might have around fertility.
Okay.
So there's not one certain test or exam you need to do where everyone's at the same level to treat it, but there can be a big variation. That's why finding a practitioner that has that experience is important.
What are you looking at with fertility?
We start with the menstrual cycle. We'll be asking you questions about your period, what it's like, whether you get pain, ovulation, and we're looking at things like your lining. So we're just trying to support every aspect of each step that will support your fertility. Implantation. Acupuncture has a lot also to offer in the early stages of pregnancy. I think a really big thing is we're reducing stress.
Yeah, because it has such an impact.
Just
on
such a big
fertility.
process. It's so full on. People are already busy in their lives and then they're adding on another thing where they feel like their body's failing them and they don't know what's wrong. And I think jumping through lots of hoops and trying to figure it out can be a really stressful process.
Can be lots of appointments and different opinions. And
Yeah.
my friend did this and my sister did this, and finding your treatment and your people is really important.
Yeah, finding a team, it's so important.
Yeah.
And it's different for everyone.
Yeah, some people might need a naturopath.
Or how they approach it. I mean, Nick and you have said many times before that I'm a bit of a type A personality.
Yes.
And I probably like to, from the get-go, say, this is what we're going through step by step. And if we get to this point and nothing's come up, then we'll go to this, this, and this. So I think for some people, sometimes knowing what the plan is going forward makes them feel a little bit more secure that we have a plan and that something is going to happen next. I'm not just going to be left wondering.
So when you're creating a plan for someone, you're looking obviously at the individual, and that can include pathology.
Yep.
You really like to see blood work. I know
I want to know if they've had an ultrasound before or whether the sperm's been checked. But also some of their lifestyle factors will play a big influence in their treatment plan as well. Are they exercising? Are they eating well? Are they sleeping? Are they working crazy amount of hours and they have no alone time? Like little things that we can change.
Again, that stress picture.
Yeah.
Things that can impact the body.
A lot of people are in a stress cycle.
A lot of people ask me, and I know this as a client that it doesn't hurt, but a lot of people are a bit scared of needles and they ask me if it hurts.
Yeah, we get this a lot. And I think acupuncture itself is not meant to be painful. In fact, most people find it relaxing. You fall asleep generally, don't you, Libby? Yeah. I'm the same now. As soon as those first needles go in, I'm basically gone.
Yeah, stop talking. I can't talk to you now.
And we get a lot of people that come out of the room unable to hold a conversation.
I always think we should do the payments beforehand because it's just very hard at the end.
And a lot of people who are scared of needles are absolutely fine with acupuncture. It's just such a different process. It's so different to dry needling. I mean, different acupuncturists will do different styles of needling, but we are so gentle. And I think working in the fertility area, We just want to make everything nice and calm.
Mm.
So it's really gentle acupuncture. And I often find that the first time people have acupuncture, they can just be laying there thinking, I've got needles in me, it's really weird. And maybe their mind's not going to switch off. But once they're familiar with the process, usually it's within a few sessions and they fall asleep.
Yeah. Don't put the pressure on yourself to fall asleep in the first session if you've never
No.
had acupuncture, because it may not happen.
And we try and make the environment nice and warm and put good relaxing music on. So we'll try and get you in an environment where you'll feel safe and secure and feel like you can just let go a little bit.
Yeah. I feel like calling acupuncture needles is a bit mean to them, because it's not like having an injection
No,
or having
and we're
blood
not,
drawn.
yeah.
They're so fine. They're so tiny.
Yeah, you don't really feel them at all.
No. There might be a little pinch and then that's it.
Yeah, exactly.
Like it doesn't ache.
No, and we don't want it to be aching and painful because we'll usually adjust the needle then.
Mhm. I know we've talked about when we were chatting about ourselves in our first little episode that we hated doing because we don't like talking about ourselves. I know
That was the episode that took us so many goes.
But you did mention sort of the evolution of coming into fertility as a practitioner, like it wasn't where you were starting. And now you've created Natural Fertility Geelong. What was your idea behind creating that? Because it's become a real hub of practitioners and resources.
Yeah, I really wanted to create a space where women felt heard and felt safe to talk about all the things they felt vulnerable about, where they could get good evidence based information without the judgment. I guess we're a very integrative clinic. I never want patients to think they have to choose between natural and Western medicine. Like, there's such a place for both parts, and they actually work really well together. So many women will choose to do IVF, but then continue with their acupuncture or their naturopath to optimize their health. But really, what we want to do is we want to give you all of the information. Then you can choose what journey that's right for you. And it's different for everyone. Some people, they don't want to do anything medical. They want to do everything as natural as possible. And we're there for it. And for the person that says, I just want to go and get this happening, I want to do IVF, we're also there for that person. There's
Absolutely.
no wrong or right way to do it. And I think a lot of women feel a lot of judgment even about how they birth their babies or, the type of care they want. And it's about finding what's right for you and feeling empowered in that. And we want women to feel more empowered.
And again, back to the individual. Everybody's story, journey, process
Yes.
is different.
Or, they feel this pressure to be like their friends on some level. I mean, I can't tell you how many people tell me they feel guilty about wanting to be induced.
Oh, really?
Or,
Wow.
booking in for a Caesar instead of going for a VBAC. Everyone's story is really different.
A lot of pressure, isn't there?
With the clinic as well, I really want people to feel empowered with the knowledge that they know their bodies.
Yeah, that's
They know
beautiful.
their cycles and they know what their next steps are. So they're making that decision that feels right for them. And then they're finding a team that fits really well for them too.
Yeah.
So if they need someone else, if they need to see a fertility specialist, they've got someone that they feel like they're really connecting with and that they trust, or, we might get a nutritionist on board or a naturopath, and we're all working together because we've got the same goal, which is to help them. It's always been the driving force behind the clinic.
And I think too, being part of the clinic for nearly 5 years, I've seen how much knowledge has been gained by our practitioners with what's unavailable in Geelong, the different practitioners people can see. Like, I think it's become a real hub of referral as well, because you guys are really happy to refer to people.
Yeah, and we're really happy to refer within the clinic to different practitioners. I think we all have our special focus and different areas of training, and I want them to practice in their own way as well. But quite often I'll go, I actually think Bianca's a better fit for you because of this reason. She's doing her Masters of Herbs, or Millie's a functional medicine practitioner. Like, we want the best outcome for our patient. And sometimes that means sending them off somewhere else or getting someone else involved as well.
Yeah.
So we'll always have the patient involved in that planning.
The clinic has such a team vibe about it.
Yeah, we have a lot of fun.
We do. Should we talk about some nuts and bolts?
Yeah, let's talk about some of the things that you get asked a lot.
Yeah. So Things that I get asked via phone and email are things like what happens in an initial appointment? Like, do I get acupuncture?
Yes. Always get acupuncture with all your sessions unless you're booking in for a session without acupuncture. Like if you're just coming in for a herbal consultation or a phone consultation. But generally in an initial consultation, we will go through all of your history, not just your medical fertility history, but we'll also go through a lot of lifestyle stuff. We want to know everything about your periods. We want to know about what you're eating, how you're sleeping, how you're feeling about everything, what you want to work on first, like what you're hoping to get as an outcome. If you are in a heterosexual relationship and we're working with a partner as well, we'll be asking about those details. We really go through everything, and then we talk about what our next steps are. A big thing we go through as well is the time frame that someone wants to work in. There's some
That's the other question I do get asked a lot as well on the phone. Like, how often do I have to come in or how long do I have to come in for?
Yeah, and it really can depend on a lot of things. Like if someone's coming in for prep and they go, I don't want to try until next year, we've got heaps of times. They don't have to have so many appointments close together. We can work on things really slowly.
Mm.
If someone wants to try in the next 2 months and we have a shorter time frame to prepare, we might often start with seeing someone weekly, and based on how their health's doing, what their bloods are showing us, that can really dictate how things go as well. But ideally, we want to see you 2 to 3 months before you start, especially if you're doing an IVF cycle or something like that, if you need to prepare.
Another question I get is it just acupuncture?
No. So we will often do Chinese herbs if we think it's needed, definitely supplements, and definitely lifestyle advice. If I feel like someone needs a bit more support with diet, I'll often send them to Marie, our nutritionist, or a naturopath if I feel like it's a little bit more complex. It's a really holistic approach, not just acupuncture.
People often ask me which practitioner they should see. And I think probably over the years I've developed the skills to be able to refer people. So I'll just answer this question. Feel free on the phone to tell me things. So
Yeah, and people do often.
tell me about your cycle or what your goals are, what areas you think you're needing help in. I'm happy to kind of triage from there. If I don't know the answer, I'll tell you and I'll just talk to one of the girls
Yeah, we
about
do that a lot.
where we think the best fit would be. But I can definitely help over the phone if you're unsure with which practitioner to see.
The other thing we probably get asked a lot is if you should come in at a certain time of your cycle.
Oh, I get that asked every week.
Yeah, and the answer is no. Acupuncture doesn't work where you have to come in just before ovulation or you have to come in at a certain time unless you're doing an IVF transfer. It has an accumulative effect, which is like building up on a bank account. And the more acupuncture you have, better the effect's going to be. But we want to see you at all times. Even if you have your period, still come in. We get this a lot with the guys. I don't know why in particular, but they always think they need to come in just before their partner's ovulating, and it doesn't work. We just need to see them making those changes for the next 3 months and coming in every week or every fortnight or however.
Like you said, it's accumulative, not targeted.
Yeah,
In
so
some
it doesn't
cases it
work
is,
like
but
a drug, essentially.
Yeah.
We're not going to see that effect necessarily in a really big way over the next 24 hours, but we probably will over weeks of work.
Another one I do get asked a lot, and there's probably a few answers for it, is can we come in as a couple? So how do we treat couples within our clinic's system?
So each person has their own appointment. So they don't come, we don't have beds in the same room. So each partner would have to have their own appointment where the focus is on them, but they can join the consultation.
Mm-hmm.
If we're working with the female, her partner can sit in it too, which can be really helpful, or vice versa. But it's essentially their own session.
And that's coming back again to what we're talking about at the start about the individual.
Yeah, otherwise we'd be there for 2 hours.
Yeah,
talking about both of them.
And when you're in an appointment, it's really all about you. The focus is on...
Yeah, the focus is on you. And sometimes people won't share everything in front of their partner.
Yeah.
Or they want to, be able to feel free to talk about things outside of the relationship.
Yeah.
And sometimes this is why within a couple, maybe one of them will see one practitioner and someone will see another.
Yeah, we do have that quite a bit actually, don't we?
So they get their own time as well.
Mm. Some other stuff I'd like to ask you about is supporting people through IVF with acupuncture and Chinese medicine.
So specifically, do you want to know, I guess a lot of people ask about the research.
Yeah, like why would I do both at once?
Yeah, okay. There is definitely a lot of research out there now around acupuncture and IVF support. And I think this is where people are jumping on Google and on forums, and everyone, like a lot of people will come in and say, I read that I need to be doing acupuncture. But I would say we are in need of a lot more good quality research. So we know from research in other areas that acupuncture is really effective in treating pain, but it really has so much more to offer.
Mm.
There's a really big growing body of evidence that acupuncture can reduce stress, which can then improve IVF outcomes. So there's been over 40 clinical trials, but I'll just say that each study design has been really different. The amount of treatments or acupuncture treatments that have been done within those studies vary, and the protocol of points. So there's just so much variation in which could influence the results as well. I really love Helena Lee Rubin's work. So she's in America, but she does a lot of work on acupuncture research in IVF and fertility. So she talks a lot about a thing called whole systems Chinese medicine. Research that has been done involves just acupuncture as a standalone treatment, and it's often done in a very protocol-based way, and it will involve like 1 or 2 sessions. Whole systems Chinese medicine reflects probably a more accurate approach to how we actually treat. So each treatment protocol is individualized. There's more treatments in preparation of the cycle, and we absolutely include Chinese herbal medicine, moxa, supplements, and lifestyle factors. She compared whole systems Chinese medicine to acupuncture as a standalone, and we know that the whole systems Chinese medicine has better outcomes. But
Okay.
being able to study this properly is tricky,
Yes.
and there's a lot of variables to work with.
Research doesn't like lots of variables.
Yeah. So it's different to studying a drug.
Yes.
And having a placebo acupuncture treatment is tricky as well.
Mm.
Yeah, there's these little devices that you would use. The needle actually doesn't go in,
Oh.
kind of folds in on itself.
Is it still in that where that point would be though?
No,
Okay.
in a different point.
Okay. So it
But
wouldn't
each
be.
study design is really different. But what I'm just saying is the way that they study it doesn't necessarily mean it was a good quality study.
Yeah.
So we have such room for good quality study, which we need more funding, and we need a lot of things to make acupuncture a lot more accessible to people.
So what do we know about the use of IVF and acupuncture together?
From the research, so 2 to 3 acupuncture sessions performed around like the day of embryo transfer is not really enough to improve IVF birth outcomes. But what it does is it significantly reduces stress. And for some people, that's all they need to get over the line, to fall pregnant, for that transfer to work. But for others, they need a lot more. And this is where it comes back to that doing preparation, coming in 2 to 3 months beforehand, getting your body ready.
And the whole systems approach.
Yeah, exactly. So yeah, the research has a long way to come, but the evidence does suggest that having several acupuncture sessions, you can improve endometrial thickness, you can reduce stress, and other things like improving the blood flow to the ovaries.
Oh, wow.
So what we're trying to do is we're trying to support you each step of the way of your IVF process. So we want you to get more follicles. We want your lining to be thicker and more receptive, and we want to improve implantation. So basically, we're just trying to take you through each step as well, make you feel calm. Some other observational studies have also suggested that if you have more sessions, more than the 1 or 2 acupuncture sessions, there is an associated increase in clinical pregnancy and live birth rates. There are more people falling pregnant, more people carrying the babies to full term.
Wow, that's cool.
There was another study that showed that acupuncture was really effective for women who had repeated failed cycles. I think there's a lot of scope for acupuncture to be involved with IVF a lot more. But I guess knowing the exact role that acupuncture has, we don't know for sure from a scientific and medical point of view. So when you go to see your fertility specialist and you ask them if you should do acupuncture, It's a really difficult question for them to answer.
Mm.
First of all, they're not an expert in the area, but they can only advise on current evidence. There's holes there at the moment. It doesn't mean it doesn't work though.
Mm.
And there's so much variable. But aside from the research, acupuncture and Chinese medicine, it just works on so many different levels. You've got the physical, emotional, and spiritual. So when we're looking at the organs within Chinese medicine, we're not just going on what the physical function is, but we're also looking at how that function is influenced by emotions. If you're feeling angry all the time, how's that affecting your body? Or if you overthink and you're a constant worrier, or you're prone to anxiety, or if we're looking at the Shen, like are you a really happy person or you're really sad, or
What's the Shen?
the Shen is like your spirit. You look at all of these things as well when you come in for a consultation. And a lot of it is observing on how you're doing, how you're talking. I would say though, truly, I've probably had my biggest emotional shifts with acupuncture.
Really?
Over like counselling or other things like that. I remember a time when I had gone through a breakup. I don't think you know this story. I'd gone through a breakup and I probably channeled a lot of that energy into exercise, and then I just started training for a half marathon. And I was like, no,
Did you do a half marathon?
Yeah, I did it.
Oh, wow.
And then I swore I'd never run again. Yeah, I just like, I was fine. I'm fine. And then I had a treatment with a friend and she said, look, you're not fine. You're not feeling anything from the neck down.
Oh.
You did a treatment and then something just shifted. And I think pretty much as soon as I got off the table, I started crying. And then I cried for about a week, like flat out.
Oh, my God.
Like, and this is probably an extreme example, but you know when you're crying at work, you're crying at home, and then I was like, there can't be any more water that can come out of me. All this emotion was just flowing out of me. And then I think at the end of the week, I was sitting on my couch. I was just stopped. Wow. And then I just felt drained, but I was just so much lighter and I wasn't holding on to this thing anymore that I was just trying to outrun physically.
Yeah, that's so interesting.
And so I feel like that's probably an extreme example, and for people to not get worried because that doesn't happen all the time.
I haven't had an experience quite like that.
I've had a few, probably. But it's very, like, it makes sense if you knew me as a person about how extreme I can go with things. That, of course, I'd want to just rip the Band-Aid and do it in a really extreme way as well.
Of course, you just physically push yourself, push.
Yeah.
When really you probably needed spiritual nurturing.
Yeah. And sometimes with acupuncture, we need those emotional shifts in our fertility journey as well. There's so much going on, that we hold on to, and it can manifest in different areas of our body. Like, are we feeling tight in the chest? Are we holding it in our gut? Do we not sleep? Are our muscles tight all the time? It's complex. We're complex beings, and there's so much to it. And I think acupuncture can give you a pathway of allowing that to come out without talking about it all the time. That's finding what works for you.
Yeah.
If you're not really great at meditation, some people find that they can meditate when they have acupuncture, because for me in particular, I find it just takes me out of my head.
Oh, yeah, absolutely. I love meditating when I'm on that bed, if I'm not asleep.
Yeah, actually, some people bring in their AirPods and they'll do a meditation on the table instead of listening to the music.
Oh, I didn't know that. I love that.
Yeah,
of course, I would love that.
Yes,
but they do that.
For people that haven't listened to the first episode, Libby's also a meditation teacher.
What a combo. Put those two together. Do you think we've covered everything?
Yeah, I hope that gives you a bit more insight into what acupuncture is and how it works and how we view it in our clinic. If you have any other questions about Chinese medicine or acupuncture, feel free to give us a call at the clinic or send us a DM.
We're always happy to answer
We
questions.
can answer those.
Yeah. Thanks for all your great answers, Jaya.
No problem.
See you next time.
Thank you for listening. If you enjoyed today's episode, please share it with a friend, subscribe where you listen, or head to Apple to rate and review. You will find the show notes on our website, conceivethepodcast.com.au, and can follow us on Instagram at conceive_podcast, where you can also leave questions for future episodes.